Good morning, everyone. Today I did my report on healthcare in the USA. In this slideshow, I am going to be talking about our healthcare system and more specifically what it was like in the past, how it has changed, what some of the advantages and disadvantages are to it, how it affects our economy, why people still aren't getting healthcare, and what the future looks like. In this slideshow, I am going to be talking about first, what our healthcare system used to be like. So prior to Obamacare, which was put into place on March 23rd, 2010, people were constantly talking about the rising cost of healthcare. So I went and did some research and figured out why the cost was constantly rising. And what I found was that it was because of the constant new technology that we are getting. And along with that, I also found out that the improvements we are constantly making to the medication we give people is also part of the reason why it is going up. Next is how our healthcare system has changed since then. One of the ways it has made this possible is by creating ways for everyone to be covered under it. One of these ways is through the different healthcare acts they have passed. One specifically is the Affordable Care Act, or the ACA. This was passed in March 2010, and what it did was implement 3 stabilization programs. And these 3 were the Permanent Risk Adjustment Program, the Transitional Risk Program, and the Reinsurance Program. And the purpose of these were to give people the stability and the flexibility that they needed in order to make good choices about their health. And then finally, healthcare has also improved not just the coverage, but also the cost and the care we get. They have done this by making it so health plans now have to cover emergency services, things to do with your pregnancy, maternity, newborn care, and a few other things such as prescription drugs and oral and vision care for children. Now, some of the advantages and disadvantages of our healthcare system. One of the advantages is that Medicaid covers children, and because of this, many of those that wouldn't be covered normally are now able to not just afford it, but keep their children healthy and getting the health care that they need. The second one is that it allows young adults the ability to stay on their parents' plan. And in addition to this, there's also a large number of options out there for people to choose from when it comes to the healthcare plan that they want. Next, for disadvantages, as mentioned before, the high cost is always going to be a problem. But in addition to this, because of this high cost, people are starting to get insurance through their employers because it is cheaper. But because they are doing it this way, it can cause problems because it could make it not the most efficient or permanent thing that they have going. I say this because if you do have health insurance through your employer and something were to happen, like you lose your job, it might not carry over with you, and then you could be in some big trouble. Then there's the effect that it has on our economy. Based off research done by the Council of Economic Advisors, or the CEA, what they have found is by slowing the rising cost of insurance could have potentially many different effects on our economy. And these are just a few of them. The first is by lowering the cost, it could potentially prevent the federal budget deficit from continually growing in large amounts. In addition to lowering the cost, another benefit would be that it could increase labor and therefore leading to a lower unemployment rate. And then the last one is that by lowering this, the CEA found that the cost could have a big effect on the government's budget, so much that by 2040, 15% of the GDP will be from spending money on just Medicaid and Medicare. Now for the big question that I have been asking since we've started talking about healthcare, and that is why people still aren't getting it. And what the CEA found is that a big part of it is from costs, as we've discussed before. But right now, the number of Americans who aren't covered is at 46 million, and the CEA is only predicting that that number will continue to increase up to 72 million by the year 2040. And based on the Fred graph in figure 4, that is confirmed. As you can see from this figure, back in 1990, we were spending about $500 billion in healthcare. And not even 25 years later, in 2014, that number had grown to about $2,000 billion that were being spent on healthcare. But even with these numbers, it's not reason enough to not be covered, especially when you look at figures 1 through 3. So in figure 1, it shows the hundreds of healthcare systems that are federally qualified to be healthcare centers around the US. And then in figure 2, what it shows is the number of people who are uninsured by state. And what the key describes below that is the darker blue you get, the that shows the larger amounts of people that are uninsured. So you want to be in one of those lighter areas, which are the areas where there are fewer people that are uninsured. And then finally, in figure 3, this is kind of a combination map of the two. It overlaps them to show the areas where all the healthcare centers are, and then also the number of people that are uninsured by healthcare. And what I noticed from this was that some of the areas that had the most healthcare centers were also the areas that had the most people that were uninsured. And this is one thing that I wasn't quite able to figure out. And I was wondering why there was a reason, if there was a reason for this. So after doing all this research, I looked up if there was anything that our future healthcare system would be able to do to potentially help stop some of these problems from occurring. And what I found was that one idea was to increase the access people have to it so that all levels of society would be able to use it. In addition to this, the future healthcare system has created a list of goals that they want to complete. And the first is to get the stakeholders involved in the research so that they will be able to make better policy decisions on not just regional cases but also international ones. Along with this, they will be able to get more efficient information, and that will help them to see if there is any problems in the health service in the way it's delivered. And then finally, their third goal was to make sure there's effective communication going on so that the flow of information will be much better. And then another thing that I found that would help our future healthcare system was to take the technology that we have today and use it to make things less general and more personal so that it is specific to that person's needs. So these are just a few of the things that I found out about our healthcare system from doing this project. Thank you for listening, and I hope you enjoyed it.